Hi, my name is Cynthia, and I work here at Tidwell Family Care. I'm the front office lead, and we've implemented Vista over a year ago, and it's been incredible. We've been working with this system, and our work has changed dramatically. We have a sample here for of charts. Usually with referrals, our stacks would go up this high, and we would have to work through the patient's referrals and go into each chart and scan through each page and see what documents we needed to fax, and it was really hectic. And now we're down to a computer, so you can work from any station, you can work on referrals, you can work cashiering, scheduling, anything. All our information is where it's accessible anywhere you're at.
Yeah, but apparently the files have not disappeared. There are still files here.
This is only files that we got because we're going to have a chart audit. So because we don't have everything they want, sometimes we have to request the charts. So that way when they do the audits, they have to come back. We have to request the charts in, and then they have to go through and make sure that the old notes are in here, and then they're going to look into the chart and scan
before EMR implementation, right?
Correct.
Oh,
Yes.
so now in the future it will not be required. This is just because of a audit. Otherwise, the
Correct.
files wouldn't be.
These are just charts that were requested for an audit.
Who does the audit?
Kimberly in medical records. She's the
Okay.
one in charge. They for example, insurances request an audit. Sometimes it can be like sometimes it can go from being insurances, Medicare. They just want to request amounts. Sometimes they want to see 10 charts. Sometimes they want to see 150. I believe today she had a 150 chart audit. So that's the reason why we get.
No, where are these files kept? There, obviously, this room was full of files and is now quite empty.
Correct.
So, where have all the files gone?
All the files have actually go to our storage, which is Iron Mountain. So we send all our files over. So all the notes that were, we have most important notes already scanned into the patient's chart here. But before we had this, it was that part over there was medical records, and they had another portion here. And I believe 3 years ago, this room here, this was an actual other room, and it also had charts. So we had charts here, here, there, and sometimes at the front.
About how many charts were there typically?
Wow. Charts.
Say about
thousands. I would say thousands.
about 10,000 charts.
I would say because we kept we wouldn't before we wouldn't purge charts every so often. I know at the end we did purge them after 2 years, but at one point we weren't doing that, so we were just accumulating charts. Some charts would range from being this thin. Some charts would range from being this thick.
Yeah.
So we had to work. Sometimes patients even had up to 4 volumes of charts.
So one is you eliminated the paper records. Then what are the other areas of savings or benefits that you've got? Like you're saying, what's it, consults, and what are the other areas where there has been saving in time and
well, with the
efforts?
referrals, like I said, I mentioned, for example, we would have to deal with a chart, let's say, this big, and they would be going, let's say they're going to a neurologist, and we needed to go through this whole thing, look first for all the notes, and sometimes we had loose notes in here, like for example this one. So we had to make sure we have all the pertaining notes to the referral. So we're going to see the last visit notes, check if they've had any x-rays, any MRIs, and all that. So now all we do, all that information is scanned. We just go ahead and log on to the patient's account, and all the notes are here. They're all scanned. So we'll just go to the scanned document that we're needing, go ahead and view it, see if that's the one we're needing, and from here we'll just go ahead and go to our main screen for referrals and send all that information out, as opposed to going through this. This would sometimes take from 10, 15, 20 minutes. And sometimes we would go ahead and send the referral and the notes, and it seemed like all the time we would have to send additional notes because all the notes that we sent weren't enough for them. So now we have everything here, and instead of going through each sheet, we just go down the title and see if this one is the one we're needing, as opposed to going through each piece of paper and seeing if that's what's going to.
But now you have to print it out and send it to the referral.
We don't print it out. Actually, the way we do it in, like for example, in referrals, we just copy the note and we just attach it to the referral. So every time when we're sending a referral, we copy and paste all the notes we're needing. So that's gonna go ahead and be attached to the referral, and when we fax it out over, all that information is gonna be sent.
Or without printing it, the fax machine
Without printing it.
will print it at their
Correct.
site.
And there we don't print anything. We just go ahead and send the fax over. They receive the referral, the consult, and all the notes.
Then what are the other areas you feel there's been a big change because of computer?
Cashier was another area. For example, before we used to go based on the super bill, and the way that worked. The super bill, the doctor would, most codes were on there. They would just circle the code. So we just went back, and whatever was in front of the super bill was the procedure, and whatever was in the back was a diagnosis. So we would just have to flip from, the front and back to check what the doctor had for that visit. So for example, now sometimes the doctors wouldn't find the diagnosis on the actual super bill, so they would just write it down. So before, what we'd have to do, if they did that and they didn't put a code, we would have to go back to our CPT book or our to look for the code. So we would waste time sometimes and trying to look for the code because the doctor didn't write it down. And that, we were afraid of doing that because we're like, what if we put the wrong diagnosis down? Or so that was always. And now with this, the doctor just enters it, the code is there, so there's no question about it.
So first is you eliminated paper, second is it made it easier for you to do your referrals, and thirdly for the billing.
Correct.
These are the major areas in the front office that you found as saving?
And phones also, because phones before, let's say, we get a lot of calls for med refills, we get calls for lab results, we get calls for referral statuses. So everything, instead of going, before we would have to put in requests for charts, and we had a list that we had to write down what chart we needed, by when did we need it. So sometimes we would end up with that whole list full. And next thing you know, we had a stack of charts this big waiting in our desk so we can look for the information we needed. And with this, now everything's here. Like if the patient calls and wants their referral status, we just go to a consult and all the notes are entered in the bottom of the consult. So we'll tell them the referral was sent on the 18th. You were referred to Sunrise Medical. And the information is there. You give them the phone number. We advise the patient to call and schedule their own appointment. So that's what we would, all the information is there, as opposed to requesting the chart, going back to it, going back to consults or referrals, and then going through each one and finding it, okay, you were referred to this doctor and you need to call and schedule your appointment.
Then I think also for messaging was another area.
Messaging, yes. Messaging, before we would, again, have to request a chart, and we had little message pads. And for example, we would have to get the message, patients requesting lab results. We had the message pad attached to the chart, and we would leave it in the medical assistant's desk. And now, all we have to do, go to notes. We go to notes, new note. And then we select the doctor, and we go to telephone encounter. Okay, enter the patient's callback number, and then select what the patient's calling for. So patient, let's say patient's calling, requesting lab results. And then please call. And then we just go ahead and finish the note, send it over to the medical assistant, and it's waiting for her in her window. So we don't have to walk around with the charts and leave them in everyone's desk. And even with med refills, the same thing. Request it directly to the doctor. We can't risk the message getting lost. The patient calling back and saying, I left a message, we don't know with who, because here we always go back and we know who took the message, what time, what date. So everything is here and everyone has access to the information. So it's been great. I mean, I've been here almost 5 years, and I went from this to this, and I would never go back.
So now provider cannot put blame on you, huh?
Exactly. I was like, I did it, it's right there. So I can't.
But has it resulted in loss of jobs, or it has just improved the efficiency and the same number of people are still there?
I think there's no loss of jobs. I mean, just
No.
the role is allocated to different role, right?
And it's better because this has actually helped us help out each other more, as opposed to being just in each department, like, okay, I do referrals. Before, if a patient would call and say, I need to check status on my referral, we didn't have the chart there with us. So we had to check first if the referral department had it. Second, if they didn't, we would have to come to medical records. So now it's better because we're helping each other out. We're helping, okay, you have a referral question, here you go. And the medical assistants are all able to view all this information. Everyone is.
But because of EMR, there's no loss of job. Right?
No, not at all.
That's because one of the biggest concern of those employees are, now we have EMR in the medical record. People think, what now we are going to do now?
Yeah.
I mean, maybe people lose their job.
No, not at all. I think it's even made our jobs easier. It's made our jobs easier, and it's been a great thing to us. Honestly, I have nothing bad to say about it. It's made all our jobs easier. We're less, we have less phone calls coming in because, complaints and, I've been calling and calling, I'm not getting anywhere through. Even we've gotten some patients that instead of going to their pharmacy, they prefer and call us to request their refills because they know we're going to get a faster response. And as opposed to going to their pharmacy, waiting for the pharmacy to fax over the request. So now, because they know we request the medications for them, they go ahead and call us.
Yes.
And they're like, and sometimes we'll suggest, have you gone to your pharmacy to get your refill? And they're like, well, you're faster, so we'll prefer to go through you. So that's been.
What happens? They come to you, so you will fax the.
No, we request the refill to the doctor. So the doctor will either approve it, or if it's a, let's say for example, it's a narcotic and needs their actual physical signature, then in that case the doctor will print it out. So.
And you'll fax it to the pharmacy.
No, in cases like that, we actually have the patient come in. They have to physically pick up the prescription. In cases as like if it's a medication that can be called in, we just ask for the patient's pharmacy, the patient's pharmacy number, and that can be called in by the medical assistant. So once the doctor orders it, sends it to the medical assistant, and they go ahead and call it in.
And then
as opposed to waiting for a fax and getting it attached to the chart, and then the chart going to the doctor, and the chart the doctor having to go through each page to see if everything's there or not.
Thank you very much. That was a beautiful orientation about how things have happened. You've been here a long time, isn't it?
Almost 5 years.
And when did this process begin?
This began, it would be 2 years in January, correct?
August.
August?
Yes. I mean, we implemented this EMR on 10th August 2007.
Yes.
So,
but we began since like beginning of January, right? And we started kind of.
Feeling comfortable with that system? Yeah.
January of 2008, is it?
2008.
Yes, that's when we went full blown.
So about a year and a half you've been using this new system?
Correct.
And it must have improved over time?
Yes, it has.
Right. Thank you so very much.
Tremendously. No problem.
Right. Okay, bye.
Thank you.